Why did the vampire bite the diabetic?
Why?
Because he had a sweet tooth.
Ha
My name is Melissa Fournier. I work as a medical assistant in a small family practice office. Oh my god, I can't do that with you guys. Where we see a variety of different patients. And most of those have diabetes. So I see it daily. According to the Center for Disease Control and Prevention, 1 out of 3 people will have this condition and not know it. That's an estimated 86 million adults in the U.S., and 90% of them are completely unaware that they have diabetes. There are 2 types of diabetes, type 1 and type 2. Today I will inform you about type 2 diabetes, what it is, the symptoms to look for, and the contributing risk factors that increase one's chances of becoming a diabetic. Type 2 diabetes is a chronic, lifelong condition and the most commonly diagnosed. The body can't make enough insulin or can't use insulin very well, creating an inability to process sugar, also known as glucose, properly. Hyperglycemia is where there is too much sugar in the bloodstream. Hypoglycemia is where there's not enough sugar in the bloodstream. The body has a difficult time providing energy to the cells that make up muscles and other tissues. Now that we know a little bit about type 2 diabetes, let's take a look at some of the symptoms to look for. Most people with type 2 diabetes don't know they have it at first, but over time the symptoms do begin to appear. It is important to keep blood sugar within normal range. An A1C is a finger stick that provides the average sugar levels over a 3-month period. Common symptoms include frequent urination, excessive thirst, weight loss with an increased appetite, and blurry vision. Other symptoms may also include sweating, shakiness, weakness, and possible confusion. Unfortunately, no one is immune. It now affects children as well as adults. Diabetes can lead to more serious problems and other health conditions such as high blood pressure, high cholesterol, kidney failure, and blindness. It also damages blood vessels and nerves, mainly in the feet, leading to hard to treat infections. Amputations are sometimes necessary to prevent the spread of those infections. Now that we talked about the expected symptoms, we will discuss the specific risk factors. There are some root causes that increase one's chances of being diagnosed with diabetes. What are controllable risk factors?
Being fat.
Things
Eat red meat.
that one can control. Weight. Being overweight with a body mass index or BMI over 25.
Mm-hmm.
Diet. Eating red meat or processed foods, as well as drinking sugar-sweetened beverages like sweet tea. Exercise, or the lack of. They all kind of coincide with one another. What are uncontrollable risk factors? Things that you can't control,
Right.
that you have no power of changing,
Right.
like age. Although we do wish we could find the fountain of youth, but that's still in the works.
Yeah. Yeah.
Okay.
Yeah.
Risk increases after 45 and even more so after 65. Sex. Women
Lack
are
of.
more likely than men, especially if they had gestational diabetes during pregnancy, or those with polycystic ovarian syndrome. Race or ethnicity. It's unclear why African Americans, Hispanics,
Islanders.
Native Americans, Asians, and Pacific Islanders have greater risk than others. Hereditary. If the condition already runs in the family, those members have a higher chance of being diagnosed than someone whose family doesn't already have it. In conclusion, we have talked about type 2 diabetes, what it is, the symptoms to look for, and the risk factors associated. On death certificates, diabetes is listed as the 7th leading cause of death in the United States. Now you know more about diabetes type 2 and what to look for.
Cool.
To my cue.